Greetings and welcome to the lecture for Chapter 10. This is the lecture on how to work with couples and families. You will note that I'm going to review this, that there was not a lecture for Chapter 5 and so you will notice that this is going to be the last chapter that has slides associated with it. But this week I've uploaded the lectures for Chapter 9 on assessment and Chapter 10, how to work with couples and families. One of the basics of this is going to be the other things that we're going to see, other symptoms that we're going to see besides chemical dependency when working with family. And what we talk about is just basically what you need to look at and understand about each and every family. Of course, we know that families are unique. Every one family is different, with family survival roles, with family interactions. Sometimes families can be volatile. There can be aggression and rage involved in one or more family members trying to get their point across, or a breakdown in communication where the rules in the family become don't talk, don't feel, and there's a resistance by family members to change. It's a part of that volatility comes from the family being under pressure. And then, of course, if substance abuse is present, it could be chaos and turmoil, and that's the pressure that the family is under, which is seen as a reaction to the chemical dependency. Some things we need to watch for when working with families, is manipulativeness, interaction, denial and rationalization. A lot of family members believe that if the drinking and drug use ceases, that the problems will end. Of course, we know that's not true. A lot of times when the drinking and drug use ends, the problems come into a greater perspective. What you need in order to work with families, and one of the key elements of being a chemical dependency counselor is working with families. And one of the keys to that is being able to understand and have a basic framework or theory that helps you to conceptualize or understand the problems. And we've worked about that on that a lot this semester with the thermostat, with family survival roles, with the family system theory. So we've had a lot of look at different theories and ways that you can view the family through your theoretical perspectives. Also, we have to have a calmness, ingenuity, perception, and space. And what this means is that we have to have the abilities to know when there's a time to interject. Keep in mind that if you ever watch, and part of this class we watch the intervention. If you ever watch intervention on A&E, those therapists, the chemical dependency counselors, the interventionists, are very calm. They have an ingenuity to use the theoretical framework when discussing things with the family and sticking to the model that they're using. Also, perception, to be able to see and feel the different things that are going on within the family, especially when there's any suspected abuse, neglect, or exploitation of any of the family members, be it an elderly or a child. And, those are things that we have to report. But you need to have a perception for the inner workings. One of the things I've noticed with spouses or enablers, when we do family groups at the agency that I work with, is that a lot of times as a counselor, I have to hold myself back because I'm thinking, well, he's sober now, but he's not going to stay sober if you keep talking to him like that. But I have to know that those thoughts are not always appropriate in that open family setting. Now, there's some things where you have to work with clients to realize when the people in their environment might be triggers for them to use. So the space means to allow the client to see those things on their own accord, for the client to be able to come to an understanding of those situations instead of always being the one to point them out. Now, part of the assignment that we've been working on now is the family genogram. So, education of substance abuse in couples and families, a bibliotherapy, and then also Al-Anon, a bibliotherapy, some type of works, books for the addicted or for the family to read, and also Al-Anon, which is I'm going to upload a link to Al-Anon Speaks for Itself, which is a video that has gives a good description of Al-Anon. It's from the late 70s, early 80s, so it's a little outdated. But what you want to look at is enabling the family to work through the conflicts, to promote change, to be able to help them to achieve a higher level of functioning and emotional maturity. This means that there's got to be a support without judgment. You'll see denial and rationalization, so work with it. Use your motivational interviewing skills, and also you, as the counselor, you have to have insight into how everyone is interrelated. You have to look at the basic goal and of systems theory is to look at the hidden and underlying modes and modalities that each of the family member may have, and the goal would be to dissolve triangles and to be able to address these hidden conflict and secrets, redirect reactionary patterns, and establish appropriate boundaries in the family. So that's what the goal is here. And you'll be able to do so with this insight that we're talking about here. Keep in mind that you, as the counselor, should remain detached. You shouldn't have an emotional response that is visible, that's going to be shown in the session. Now, and this is where you have to understand your own biases and your own limitations, and you have to understand if you're an adult child of an alcoholic, you've got to fix your own problems before you can go in and work to facilitate others to fix theirs. True for any therapy, you must remain neutral, cannot take sides with the family, you cannot be overly supportive of the family, because keep in mind that you're there for the addict. The family is there for the addict. One of the things we have to understand and realize, we have to advocate for our clients and not really choose a side. We need to remain neutral, especially in marriage and couples counseling as well as family sessions. Problems with this is people may have personal problems in their life that will cause transference or even counter-transference with the family sessions. There's may not have a sound theory operating from. Sound theory means that if you're going to choose one of these theories or more of them and be eclectic in your presentation from this book, then you have to stick to the theory. Do not try and step outside the box of true techniques and sound theory. Of course, we look at a lot of the limitations of this comes from inexperience. When you're doing your supervision, find a co-facilitator, find someone that you can do family therapy with, the family sessions with. In most cases, when you're in your clinical training institution doing your supervised work experience, you're going to have an LCDC or a clinical supervisor that's going to be guiding you in this. And also, be cautious of dual relationships. The problems with this is that the dual relationship, because you cannot be a direct counselor to an individual and also be a direct counselor to another individual that are family members. You can be the counselor to this individual and their family members be a part of their treatment, but it is, and when we talk about marriage and family therapy, you can counsel two together, and that's why marriage and family therapy is its own discipline now, because it is a discipline in and of itself, and how that discipline works is, it's very dynamic because you're dealing with two individuals, but you're seeing them as a couple. So you have to be, there is some caution that should be here in order to make sure that there's not some type of dual relationship. And you also want to make sure that you're not being pulled into the family emotional system. You're not pulled into the system and the way that the system is operating. Because if you think of a system, and there's a video that I am going to try and record and upload for you also on codependency. And if I'm able to do so, then you'll see it's one of the best descriptions. And I show it when I teach this class live on campus. It shows some cogs turning, and then it shows anytime that someone goes against that. The dysfunction, that it causes a stress on the family unit. Also, it's important to realize and understand that each of these people that comes into this are individuals, and you know, there are individual issues that are going to come into this. The course, Assessment of Severity of Substance Abuse and Effects on the Family, recommends stopping the substance abuse. Of course, we don't want to take anyone into formal therapy that's still actively using. So whether or not there's detoxification needed or some type of, random intervention to help the client become sober, sobriety is definitely one of the main tasks that should be undertaken before entering into chemical dependency counseling, or even before we start the family process. Denial or anger are usually seen in the beginning because they're starting to deal with the emotions that are coming from being sober. Also, when we talk about the assessment, we want to make sure the assessment is of the entire family, and that we get multiple perspectives on the addiction. Once people are heard and education is given, work can be done. There's a progression, much like we see with the stages of change. You'll see how it affects the entire family. You'll also see family members continue their enabling behaviors, enabling the addictive behavior, and avoiding also change as well. And then you'll also see a lot of shame, guilt, and underlying issues. Even we would call them adult characteristics of alcoholics. If there's continual patterns of substance abuse in the family, then you'll see that on a greater scale when the family comes together. And you will see lots of unique interactions. It makes me think of the as myself being an adult child of an alcoholic. I grew up in a home where my father was a heavy alcoholic all of my years growing up. I'm the youngest of four. Just talking about this lecture makes me think of now as adults, my siblings and myself, we have a bond that's so strong from dealing with what we dealt with at a young age. And when I teach a DWI intervention, a part of that program that I really reflect on is when we talk about the family survival roles, which Reflections from the Heart of a Child is one of the videos that shows those family survival roles. And I really identify a lot with that. So with family therapy, the thing that I find the most unique and interesting is when we see those family members come together and their body language with one another, the way they comfort one another, the true sense of knowing someone on that level of no one else knows you quite like your family, and that doesn't have to be a blood relative. In many cases, there are people who are in our lives that are not blood relatives, but we consider them family. So when we talk about family, we're talking about those people who have that close-knit connection. The ideal here of this therapy is to bring balance to the system through restoration, to redefine boundaries, roles, etc. We have parent training skills, communication skills. We want to use role plays, allowed the family counseling session to be one for there to be interaction between the family members in order to redefine the roles and to have the family interact the way that they're going to. Also, we talk about on page 108 in your book the redefining or restoring intimacy and trust, where the open lines of communication are there, boundaries are effective, and there's an ability for the family members to correct themselves. At this point in time, we are intervening, we are facilitating the change, but we have not done our jobs to the fullest effect if we don't set the family up for being able to correct themselves in the future. Our biggest goal is not to get in and fix everyone and fix everything ourselves. Our goal is to facilitate the change and to be there to help the family to work through this and learn through this so that they can be able to do the work on their own in the future. And also some work that should be done here is the work with family of origin, and this can be done as the whole family. Looking at the genogram allows someone to reflect on how this has affected their family for generations, if it has, and then also to be able to have a realization of what that effect has had over the generations. Some working considerations by Steinglass. I've shown you several videos from Steinglass. I showed you one of the videos that came after 1987, in fact, the year that she came out with her work. And she said that, first, symptoms in children help stabilize rocky marriages. And then she goes on to say that if a small symptom is in a child, that they may if the small system of the child cannot stabilize the marriage, then a larger symptom of worse behavior is needed. And this is where the family survival roles looks at the class clown making light of the jokes, or the scapegoat being the one that acts out. When you see these family survival roles, Steinglass says try not to judge or attack, focus on the present, focus on the here and now, and focus on, from the humanistics approach, focus on resolve and correcting the issues in the family. And keep in mind that all families are different. All family is going to operate within a past, present, and future framework. And each family system has a unique history and structure influenced by the parents of the parents, and the architects of the family. And the present patterns are derived from past generations and are governed by the family's hopes and goals for the future. So keep in mind that the problems are unrelated to the amount, frequency of substance you used. Crises are common in families. The goal is to help them through this current crisis in order to know how to develop the skills in order to work in future ones. Crisis resolution is in one developmental stage becomes a foundation on which the next crisis is met and becomes the basis for both individual and family goals. So the family comes from arrested development into a developmental framework to where they're able to adapt and work through situations as they arise. So the counselor has many roles here. The main role here is being a facilitator, and that includes helping to save lives. You are saving lives here. Anyone who is a fan of Celebrity Rehab with Dr. Drew will remember that they've lost several people who've gone through Celebrity Rehab, including Mike, I can't think of his last name right now, who was the guitarist from Jane's Addiction. I know that there have been a few who have passed away, who've been on Celebrity Rehab. But if you look at what Mackenzie Phillips stated was, if you look at the percentage of addicts who go on from treatment to pass, that the number, it is an astounding number of people who go on. But also with that, there's a greater amount of people who go on and get sobriety and are able to arrest the disease of addiction. Keep in mind that you're going to be in a role of protecting the well-being of the family as well as the individual, the addict or the addicted. Creates a safe environment for change, allowing people to discuss those hard things, because if they have the rules, don't talk, don't feel, don't change, then those rules have been in place, and your goal is to release those rules in a safe environment so that the family can talk, can feel what they feel. A lot of times, and keep in mind, that people may have a feeling and they may not be able to associate that feeling with what it really is: anger, hurt, loneliness, sadness. You're helping the clients to be able to identify that feeling, verbalize what it is, and then change the way that they interact with their family members as it relates to that. Sometimes it can feel like you're being a referee because families have so many things and ways that they're used to dealing with each other. And then the common pitfalls on the bottom of page 111. Be sure and read through those. There's 10 of them. And then there's exercises on page 112 that are very helpful as you get ready for the next test. This completes the lecture for chapter 10. This is the last chapter that has PowerPoints associated with it. I will be posting a final lecture to wrap up the entire book experience for this class. I hope you've enjoyed. Thanks.